Let's talk to 360 MD Sanjay Gupta, who's been looking at the provisions, joins us now. Take us through these changes and the timing. What will happen in this next year, in 2010, if this passes?
Well, for the average person out there who doesn't have a medical problem and has employer-based health care, they're probably not going to see much in the way of changes. But some things are going to be happening if this passes, and I think they're certainly worth talking about. Again, talking about this year specifically, people who have developed some sort of medical problem insured, but the amount of money the insurance company pays is capped every year. Those caps are going to go away. So people, if the healthcare costs are spiraling high, you're going to be able to continue to get that covered. Pre-existing conditions in many ways will be addressed, not fully, but what this means is that they're going to create these high-risk pools around the country. So if you're someone who's been uninsured, you have a medical problem, and you've just been unable to find insurance, you can join one of these high-risk pools and get your insurance that way. About $5 billion is going to be spent on these high-risk pools. That's how they're going to pay for it. Young adults, Anderson, we've talked about this in the past. You've graduated college, but you haven't gotten your first job yet. You can get covered up until age 26. And then also drug discounts for seniors. Everyone's been talking about this donut hole. It's a way medications are paid for or not paid for seniors. They're going to shrink that donut hole, making it a little bit easier for people to cover their costs under Medicare, Anderson.
So the supporters of this bill say, look, it's going to cover 31 million uninsured people. When would that actually kick in? And for those people who have been, putting off treatments or maybe surgeries, would they be able to get coverage right away? It doesn't sound like it.
Well, if you're uninsured and you have some sort of medical problem, you're probably going to be the most affected by this, and in a good way, because you could be able to join one of these high-risk pools, get insurance, and maybe able to get, either the operation that you're discussing about or some sort of treatment sooner. So that's probably the population that's going to benefit the most. But to your point, Anderson, this 31 million number, a lot of those people are not going to get insured for several years, maybe the year 2014. Several things are going to happen at that point. First of all, people are going to be mandated to have coverage. That's how this whole thing works. There's going to be a mandate. If you can afford to get health care insurance, you have to buy it or you get fined. If you can't afford it, you're going to get some help. You're going to get some tax breaks in the form of tax credits, depending on your income level, the size of your family, etc. But this whole idea that there's going to be these health insurance exchanges is really at the heart of all this. And this is confusing a little bit, Anderson, but think of it like as supermarkets. Instead of you sort of going out and having just a couple of insurance providers for you, you're going to have dozens. So they're competing for your business as opposed to you trying to find just a single one or two. And finally, this no discrimination based on pre-existing conditions, that kicks in full effect in 2014 for adults. And again, just because you've had some sort of medical illness in the past or even a strong family history of something, you can't be discriminated based on that. That's how you get to the 31 million number.
All right, Sanjay, thanks.